What is sports medicine?
Hey. Next to rock like Mick Foley, it's Nick Joby, kill him softly, play that shit slowly. On the keys like Tony, throwing subs, they get toasted. About my bread like a hoagie. This beat ice cold, look how I ride this Zamboni. I feel like old Tony, good anywhere you throw me. She eat a Chobani, cause her body getting...
The first doctor I ever shadowed was a sports medicine physician. During college, I worked for my school's football team, and after just a few weeks of working with the team, I noticed how common injuries are in college football. From minor ankle sprains to season-ending injuries, seemed like every week another person was getting hurt. One day at practice, I noticed someone who I've never seen before talking to some of our injured players. Turns out it was our head team physician talking to some of the players he had operated on. My exposure to medicine at this point was pretty much non-existent aside from experiences with family members being sick. So after practice, I went up to him and asked if I could shadow him to see what a sports medicine doctor does. Seeing him care for athletes and the general public with all sorts of injuries was one of the main things that made me want to explore medicine further. So once I got to medical school, I wanted to stay involved in sports medicine in some way. I became a leader for our sports medicine interest group, and I've been coordinating sideline coverage with one of our professors. My class will start clinical rotations in a few months, which means we're about to get a lot of insight into the different careers in medicine and what we might want to do with our lives. We have a formal mentorship program at our school which matches us with a physician in our chosen specialty for them to guide us through the rest of medical school and help us be successful in our careers. So because of that, myself and all my classmates have to start thinking about what specialties we want to do. Some specialties have very cut and dry paths. Want to be a pediatrician, you do a 3-year pediatric residency. However, some specialties have a few different paths to get to them. For example, for plastic surgery, you can either match straight into a 6-year integrated plastic surgery residency, or you do a 5-year general surgery residency and then a plastics fellowship on top of that. Sports medicine is one of the most diverse specialties, and I was surprised to learn how many different ways you can get into it. So I wanted to make a video on what a sports medicine doctor is and all the different paths you can take to become one. So first let's start with the AAMC's definition of sports medicine. A sports medicine physician specializes in preventing, diagnosing, and treating injuries related to participating in sports and/or exercise. In addition to the study of those fields that focus on prevention, diagnosis, treatment, and management of injuries, sports medicine also deals with illnesses and diseases that might have effects on health and physical performance. There are roughly 6,000 sports medicine physicians in the US, making it a fairly small specialty when you compare it with others. All sports medicine physicians complete some sort of residency followed by a 1 or 2-year sports medicine fellowship. As I alluded to, there are several paths to becoming a sports medicine physician, and the first big distinction you have to make is whether you're operative or non-operative. We'll start with operative since there's only one path to get there. To become an operative or surgical sports medicine physician, first you have to complete a 5-year orthopedic surgery residency. After residency, you'll do a 1-year sports medicine fellowship to subspecialize. In these fellowships, you'll focus on diagnosing and treating common sports injuries like ACL tears, rotator cuff tears, Achilles ruptures. Sports medicine surgeons focus more on soft tissue injuries when compared with other orthopedic subspecialties. That's because when you're playing sports, you're more likely to get a soft tissue injury than break a bone. There are roughly 90 surgical sports medicine fellowships in the country with an average of, I think, about 3 fellows per year, making it one of the largest subspecialties of orthopedics. Now onto the non-operative side, which can get a little confusing. There are 5 different paths to becoming a primary care or non-operative sports medicine physician. 5 specialties are family medicine, internal medicine, pediatrics, emergency medicine, and PM&R. The most common route is through a family medicine residency, so you'll complete a 3-year family medicine residency and then do a 1-year sports medicine fellowship. It's important to note that not every fellowship program will accept applicants from all 5 of those specialties I listed. Most programs will accept family medicine, but the more non-primary care specialties like EM and PM&R might have a little bit more difficulty finding a program that they can apply to. Now, I don't know the historical context as to why you can get into sports medicine through so many different routes, but I think it's great that there's so much diversity in the field. While everyone gets the same training while they're in fellowship, your primary specialty plays a big role in your overall skill set and what you can do once you're out practicing on your own. Fellowship is only 1 year, so the majority of your post-medical school training is your primary residency. So I think having so many different paths to get to sports medicine just helps diversify the field. If you're family medicine, you're going to be well trained in all of the non-musculoskeletal issues an athlete might have, because athletes get sick too. And if you're EM, you might be able to better manage some serious acute on-the-field injuries. Actually, in the past 10 years, the NHL has mandated that there has to be an emergency physician on the sideline in case a serious injury happens to a player on the ice. Another specialty that closely relates to sports medicine is sports neurology. I think this is sort of a new field of neurology, and it has a separate training path than sports medicine. They deal with brain and spinal cord issues that athletes might face, mainly concussions. NDMD made a great video on UCLA's brain sport program, so if you want to learn more about sports neurology, go check out that video. While operative sports medicine physicians focus on surgery, non-operative physicians have a bit of a wider breadth of what they do, and they're essential to any care team. They're able to treat any illness the athlete has, they can manage concussions, and they can coordinate care with other specialists if the athlete has something like type 1 diabetes or a heart condition. I'm not an expert on all the different career options, but I do know a few general settings. The first being a team physician. A team physician works with typically a college or professional sports team and takes care of the athletes. They'll do sideline coverage on game days or go to the training room to see any athletes that got hurt during practice. For sideline coverage, you're on standby for anything that happens during the game. If an athlete gets hurt, you're the one who runs out there on the field to evaluate them. This is a huge responsibility because you're the one who has the final say on if an athlete can return to play or not. You might have the coach or the player begging to go back in, but you have to look out for the health of the athlete and do what's best for them. In this setting, you work very closely with the athletic trainers since they're there every day. Usually the athletic trainers are the ones that are there when the injury occurred, and they have a good sense of the athlete's personality or needs. Being a team physician is a huge time commitment because not only are you doing the extra stuff like sideline coverage and traveling with the team, but you're usually seeing patients in an orthopedic clinic when you're not with the team. For example, the doctors that I shadowed would spend most of the day at a University of Maryland orthopedic clinic, and then afterwards they have to run over to the sports facilities to catch the end of practice, then see any athletes that got hurt that day. And just traveling with the team can be a huge time commitment depending on what sport you're covering. If you don't want to be a team physician, you can always just work for an orthopedic practice. You'll see anyone with a musculoskeletal injury like arthritis or a sprained ankle. And even if you do choose to go this route, there's still opportunities to do sports coverage. Typically high schools or local sporting events won't have a dedicated team physician, but they still need someone there on game day. Sometimes this is paid work, but sometimes it's also you just volunteering your time in order to build a solid network of patients and get your name out there. No matter what setting you practice in, sports medicine is a rewarding field. You're working with athletes and active people and are trying to get them back to where they want to be in terms of physical function. Your patient population is very motivated to get better, which can build a positive doctor-patient relationship. If you want more resources on sports medicine, check out Med School Insiders or Dr. Kevin Jabal's YouTube pages, which have great informational and day-in-the-life videos for sports medicine doctors. That is going to do it for today's video. If you enjoyed this style of video and want me to highlight other lesser-known specialties, let me know in the comments. Thanks for watching, and I will see you in the next one.